Tetrahydrozoline, which is a decongestant, is used to reduce redness in the eyes caused by minor irritations such as smog, swimming, dust, or smoke. It belongs to a group of drugs called sympathomimetic amines and works by temporarily narrowing the blood vessels in the eye. Some brands of tetrahydrozoline eye drops also contain lubricants, which help protect the eyes from further irritation and dryness. When using multi-symptom relief eye drops, make sure to follow the directions on the package or as directed by your doctor. Before applying the drops, wash your hands and avoid touching the dropper tip or letting it touch your eye or any other surface. Remove contact lenses before applying the drops and wait at least 10 minutes before reinserting them. Check the product visually before using it and do not use if the liquid has changed color or is cloudy. Keep the medication away from children and pets. Use the drops in the affected eyes up to 4 times a day as needed or as directed by your doctor. When applying the drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over the eye and place 1 drop into the pouch. Close your eyes for 1 to 2 minutes and apply gentle pressure to the corner of the eye near the nose. Avoid blinking and rubbing the eye. If your dose is more than 1 drop, repeat these steps and do the same for the other eye if directed. Do not rinse the dropper and replace the cap tightly after each use. If using other eye medications, wait at least 5 minutes before applying them, and use eye drops before eye ointments. Overuse of this medication may result in increased eye redness, so do not use it for longer than 3 to 4 days at a time. If your condition lasts or worsens after 72 hours, or if you think you may have a serious medical problem, stop using the medication and seek medical help. If you experience stinging, redness, widened pupils, or blurred vision in your eyes, it's important to let your doctor or pharmacist know right away. However, many people using this medication do not have serious side effects. Serious side effects to watch out for include eye pain, worsening redness, itching, or swelling in or around the eyes, as well as other vision problems. If you experience shakiness, fast or irregular heartbeat, headache, sweating, weakness, or nervousness, it's important to tell your doctor immediately. Although rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the best time to take this medication, it's important to follow your doctor's instructions for daily dosage and timing. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Before using multi-symptom relief eye drops, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have conditions such as glaucoma, heart problems, high blood pressure, diabetes, or overactive thyroid. After applying these eye drops, your vision may become temporarily blurred, so it's best to avoid activities that require clear vision until it's safe to do so. If you are pregnant, only use this medication if it's absolutely necessary and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it's unknown if the drug passes into breast milk. When taking multi-symptom relief eye drops, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always consult with your doctor first to get their approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, residents can call their provincial Poison Control Center. Symptoms of overdose may include drowsiness, severe sweating, decreased body temperature, and slow or shallow breathing. If you're experiencing symptoms caused by allergies, it's important to avoid allergens that could be triggering your symptoms. Common allergens include pollen, grasses, weeds, dust mites, and pet dander. If your doctor has prescribed this medication for regular use, and you happen to miss a dose, take it as soon as you remember. However, if the time for your next dose is approaching, it's best to skip the missed dose and resume with your regular dosing schedule. Do not take a double dose to make up for the missed one. It's important to use the medication as directed by your doctor for the best results. It's important to store this medication at room temperature and away from light. Make sure to keep it out of reach of children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, make sure to properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.